Welcome to Moments with Marianne. This is your host, Marianne Pastana, and we're here today with special guest, Dr. Monica Vermani, who's here to share with us her book, A Deeper Wellness: Conquering Stress, Mood, Anxiety, and Traumas. So what if the symptoms you're treating, like fatigue, anxiety, or chronic pain, aren't the real problem, but signals pointing to something deeper? Well, today's guest is here to dive into just that. One of Canada's highest-rated clinical psychologists, Dr. Monica Vermani, provides a multifaceted treatment approach in treating adolescents and adults suffering from trauma, abuse, mood, anxiety, substance addictions, and other related conditions and disorders, as well as family and couples therapy. Dr. Vermani's latest book, A Deeper Wellness: Conquering Stress, Mood, Anxiety, and Traumas, and its companion online, A Deeper Wellness Life Lessons mental health program, provide the tools to create a deep, authentic self of wellness and well-being. So welcome to the show, Dr. Monica Vermani.
Thank you very much, Marianne, for having me here.
Well, what an honor it is to have you here and to talk about not just your book, but your work. Can you share a little bit about what even drew you to the whole field of psychology?
Oh, of course. You know what? Some people choose a career. I have to say, my life has led me to my career. So I was born and raised in Toronto, and to immigrant parents, and I have had a father who went through a workplace disability. And when that happened, I think I've just been a caregiver at home. And so I think you develop certain personality traits of being caregiving and kind and empathetic. That led me to also do a lot of volunteer work at a church across the street. And, being that person who was working in fields of altruistic healing and volunteering got me to start, being very caring and compassionate to people. And as I started growing, I had people even saying, "Oh, you should go to school for that social work or psychology stuff." And I actually went to U of T when I got into university for a science degree. And so as I was doing this honors of science degree, I ended up taking psychology, sociology, criminology, and women's studies, and ended up excelling in it so much that I decided to make it a career. But along the way, I also just gravitated to getting jobs in social work or psychology with ease. And I had mentors and people who were like, "You know what? You're a great person. You work really hard. Let me give you a chance." So I just found distress lines. I got training and I volunteered there. And then I get jobs very easily in psych. So I've been one of those fortunate people in psychology who, from the age of 16, have had jobs in the field. And I'm in my 50s now.
What a remarkable story. And I love how just the path unfolded for you. You're obviously doing what you're meant to do.
Yeah, definitely am. And like I said, some people choose a career at certain points. And sometimes I think the path is just laid out for you. And it's about us learning to, trust, surrender, follow, and do what makes you happy. And I think if you're following your passions and you're doing what makes you happy, you'll figure out that balance of where you belong. And I think it's sometimes when we try to fit a square peg in a round world, and when we're trying to fit something that doesn't fit, we end up having, careers or paths that don't feel right and cause us symptoms of anxiety, stress, or burnout or depression.
Well, let's dive into your book, A Deeper Wellness. What
Mhm.
inspired you to write that?
So, as a therapist, many times it's hard for people out there to get enough time with your therapist, or they face barriers of finances or location and having to commute to see them. During the pandemic, I found a lot of my patients wanting more time, wanting to refer their friends and family, and there's only one of me. So it got to a place where I was like, let me bring some more resources out there for people who want extra support, as well as people who can't afford therapy or don't have the time and energy to make an hour for it. At least they can do some self help. So I created the book, A Deeper Wellness, and hopes to bring, self reflection, insights, knowledge, and self discovery on a self help form. And I also have at Life Lessons by Dr. Vermani, which is an online self-help program where you have one-on-one individual recordings with me, where I have handouts and worksheets that also correspond with the book. And a deeper wellness is really about you conquering high stress, mood, anxiety, traumas, and any other symptoms that you struggle with that are holding you back from living your life in a normal, healthy manner or in an ideal way for you to live in your highest and best version of you.
So let's dive into our thoughts.
Mhm.
Why focus on our thoughts?
So this one is interesting, but most of my career is really about helping you identify cognitive distortions, distorted ways of seeing reality. My TED Talk that was done at U of T is called Think About It. Thoughts are powerful things. Everything ever created out there started with a thought. Good or bad, your thoughts shape your life. If you think about our lives, propelling yourself and motivating yourself comes from a thought. Putting people down and feeling less than yourself and judgment of yourself and judgment of others is a thought. Feeling imposter syndrome is a thought. Everything is a thought. Misunderstandings with people and conflict with others can be a thought. Many times we don't realize the power of our thoughts. And in today's world, learning to understand positive or negative, every thought shapes your life. Key is slowing down enough and asking yourself, what thoughts propel me to be a higher, better version of me and which ones keep me stuck. So I always tell patients when they first start working with me, if I had a magic wand and I could take away, your negative thoughts, what would life look like? And many people give me these outstanding, simple, but outstanding remarks of like, I'd be more confident. I would be less, insecure. I'd be more loving. I'd be more courageous. I'd take more risks. I'd speak to more people. I'd socialize more. I'd date more. And it's interesting to see how our thoughts hold us back from living the life that we truly want for ourselves. And so thoughts are actually my majority of my work. I'm helping you challenge, reconceptualize, and notice where you develop negative thoughts. If you look at children, 0 to 10, they're superheroes. When you look at a child, they look in the mirror and they love themselves fully and completely as they are. They're not scrutinizing, judging, criticizing their weight or their acne or their skin. They're in a place of seeing beauty only. Children will unconditionally love you, hug, kiss you, even if you don't kiss them back. There is no judgment going on. Children speak the truth without a filter until then we start changing them to say, oh, you can't say that. Oh, you can't do that. Oh, you need to be careful. You need to follow society's rules. We start bringing in rules and regulations. We also start bringing in on a blueprint front through modeled behavior, rights and wrongs, things to do, things not to do, people pleasing, putting others ahead of yourself, self sacrifice. So, as we develop these thoughts and narratives and belief systems of how to live, some of those work in our favor to propel us and help us succeed. And some of those hold you back from being your best version of you, make you self conscious, make you insecure, and maybe judge yourself or judge others, where it's holding you back from living the dream life you would like for yourself. And so thoughts are powerful and they start from a young age when we start acquiring rule books or we personalize traumas and start feeling broken by them. When I'm not good enough, I'm not smart enough, I'm not capable. These things come from sometimes challenges or comparison by our parents, and we've digested them to a level where it's now accumulated what I call emotional debris, emotional memory of a time that was challenging for you on the inside. And some of us hold on to that suffering, and that suffering repeats over and over in different forms until we challenge them and reframe them and break ourselves free of that ball and chain of a negative thought that's holding us back.
Do you believe we could play a more active role in our health and well being?
You bet. Pure and simple. In today's world, many people focus on physical fitness. And, in my TED talk, I said if we could put as much attention on our mental fitness as we do our physical fitness, we'd be in a better state. Our mental thoughts are actually a big way forward. Your thoughts lead to your moods and physical symptoms and your negative thoughts. It's always the thought, conscious or unconscious, that is driving your behavior. Now you have to challenge where those thoughts come from, the accuracy of it, and sometimes redefining yourself with a new thought or new narrative that works in your favor for you to move forward. But we are in charge of your life. Your inner world is creating your outer world. When you feel I'm safe, healthy, and protected, you walk out there with a confidence of feeling safe, healthy, and protected. And when you feel inadequate, not good enough, you go out there looking at people or situations or events to validate that thought. Our inner world is oftentimes reflecting our outer world. We need to start working on polishing the mirror on the inside so that we see a world with more hope, positivity, gratitude, and a level of you being able to see good in you versus everything that you lack.
So, how can we start to connect the dots?
Well, first step to treatment is always going to be awareness. And so it's important for us to look at, you know, where am I going to seek help? The first line of treatment providers is your GP, your family physician. And most of us are suckers for punishment. We wait until we are suffering in such a great level before we go and get help. But most people will go to your family doctor and usually complain about physical symptoms, and you'll get a physical remedy for it. Medication can throw a blanket over your physical symptoms and dampen anxiety or depression, but it doesn't really help you break negative thought patterns, doesn't help you break negative behaviors that have now become habit, where now you maybe have addictions in place or you have self comforting behaviors like food or alcohol or escaping through sleep. We need to start challenging maladaptive behaviors and maladaptive thoughts that keep us stuck in patterns on a day-to-day basis that make us not live the life we want. Connecting the dots starts off with going, number one, to your family doctor and maybe asking for a referral that goes beyond just a physical symptom to look at, well, maybe there's something else going on. I have a lot of negative thoughts too. My mind's always racing. I can't sleep at night. Most people don't realize that our symptoms are constantly talking to us. All human behavior has a purpose, including your maladaptive ones, and all of your human symptoms have a purpose. The symptom is going to get louder and louder and louder until you treat it. Going to your family doctor is one thing. Communicating your symptoms is about you. Doctors are only as good as you allow them to be, meaning a family doctor can't accurately assess or prescribe or give you referrals if you're not communicating truly the whole picture of what's going on with you. But for you to communicate it well, you got to sit with yourself and notice, what are the negative thoughts I have? What are the negative physical symptoms I have? And what are the negative behaviors I do that are to take the edge off or are comforting me through self-soothing? Learning to understand your symptoms so you can communicate them to a family doctor is the first line of treatment. And then going out there to look at other causes for your mental health, such as maybe you avoiding the stigma that you hold on to about mental health issues. I need to be strong. Strength is actually advocating for yourself. Strength actually is communicating your symptoms accurately, and strength is seeking the help that makes you a better version of you. You literally are born alone and you die alone. You take your first breath into the world alone and you take your last breath out. It is an individual journey amongst a collective. Why do we make everybody else so much more important than ourselves? Putting yourself first. You're the VIP in your life. Learn to understand your symptoms so you can communicate them right and get the right treatment. And the first step to treatment is awareness. Be aware of yourself so you can communicate it right to have the treatment providers give you the right resources.
In your book, you mention the three-leg chair. I'd love for you to share that with us.
Yes. So all human problems, anxiety, depression, caregiver needs, caregiver to children or elderly parents, money issues, self-esteem issues, addictions, cancer, diabetes, whatever problem you want to identify in your life, sexual dysfunctioning, low self-esteem, work conflict, people problems, social anxiety, whatever you want to label as a problem. All problems in your life will always manifest in three distinct ways. The first way is through physical or physiological symptoms: headaches, muscle aches, abdominal distress, constipation, diarrhea, heart palpitations, crying, sensitivity, irritability, angry outbursts, eating too much, eating too little, sleeping too much, sleeping too little, restlessness, panic attacks, and the list goes on. One major one is fatigue, exhaustion. So the first leg, or the first way that symptoms manifest, is physical or physiological. The second leg of that table is cognitive thoughts, negative thoughts about you, your world, your capabilities. 0 to 10, you're not born in that world out there. You're born in a household. The way mom and dad love each other is love. The way mom and dad fight is conflict resolution. We learn thoughts and patterns and narratives and belief systems from our parents first. Mom's a clean freak, cleaning's a value. Dad works a lot, work's a value. The way they fight is conflict, the way they love is love. And then as we grow and go to school, we have other shapes and colors and sizes of people and experiences, and we develop sometimes moments of having thoughts from failures and successes. I'm good at this, I'm not good at this. You fail a test and you feel I'm not good enough, I'm not smart enough, I'm not capable, I'm not pretty enough. This person's better than I am. We start doing comparison. So the second leg on that table is negative thoughts about you, your world, your capabilities, what relationships look like, what conflict looks like, avoidance, denial, procrastination, things like that, that you do to maintain a certain belief system of the world. And the third way things manifest in your life as problems is maladaptive behaviors or lifestyle habits. Eating too much, eating too little, sleeping too much, sleeping too little. Alcohol and drugs numb the physical symptoms and the negative thoughts, and we do that there. Avoidance, denial, procrastination, settling in a job, staying in an abusive relationship, not standing up for yourself, not asking for that raise, not improving yourself by going to the doctor or getting the medical treatment you need, giving up on yourself, not challenging yourself to get better. And sometimes it could also be being abusive, being people pleasing, putting others ahead of yourself, self-sacrifice, and the list goes on. So again, any problem in your life will always manifest in three distinct ways: physical or physiological symptoms, negative thoughts, and negative behaviors. Sometimes just drawing a table and writing for yourself, what are the problems in my life? What are my physical symptoms? What are my negative thoughts that hold me back? And what are my negative behaviors that I do that I'm not proud of? Escaping, oversleeping, undersleeping, food, comfort habits of alcohol, drugs, or avoidance or social anxiety where you're not socializing with people or keeping too busy and overworking at times. Write them down and see accurately, okay, let's now take charge of each leg separately. What are the physical symptoms and how I can manifest treatments or bring in providers that will help me with this? What are some of my negative thoughts and how can I maybe bring in a therapist or do my own self-coaching on a self-esteem front to reframe negative thoughts I hold about the world? And what are my negative behaviors that I can slowly start taking charge of and revamp my life versus staying stuck like the hamster on the wheel, doing the same thing on a different day?
So let's dive into the subject of our thoughts, or more
Mhm.
specifically, our negative thoughts. Why are our thoughts so important?
So, thoughts oftentimes, again, hold a level of emotional debris, and emotional debris meaning emotions and feelings. Our thoughts propel us, but our thoughts also hold us back. Our thoughts are important to challenge in order for us to succeed. Like I mentioned before, in therapy sessions, I oftentimes tell people if I had a magic wand and I can take away all your problems in life, what would your life look like? And then people will look at their life with work, social, intimacy, self care, spirituality, and they'll give me a goal of where they want to be in life. And as I see that vision of where they want to be, my goal as a therapist is to take you from where you are to where you want to be. Bridging that gap is getting rid of symptoms. And the major symptom that holds us all back is sometimes the negative thoughts. Now, don't get me wrong, when you have a diagnosed condition of anxiety or depression, many of us tend to feel like we don't have control over our thoughts. We feel as if our mind is racing, we're ruminating, thinking about things over and over and over and over again. And post pandemic, things like generalized anxiety disorder, chronic worry about real life concerns have increased, or depression, even, where people find they have a more pessimistic outlook of the world. It's important for us to start recognizing what are thoughts on a day to day basis that I hold. When I wake up in the morning, do I have a sense of dread for my day or am I looking forward to my day? Do I have a moment of saying thank you, thank you, thank you, and having gratitude for what is working, or am I constantly looking at what is lacking? It is important for us to start challenging the negative thoughts that sometimes hold us back. And I oftentimes will challenge people to say that, again, all human behaviors have a purpose. Sometimes us not making even time to address things has a purpose of staying stuck because it's better to live with what I know than to live with a new life with better changes. New environments, new thoughts This is about challenging things. 0 to 10, like I said, children live in the moment. You are here and now, and you're in a really good space. Children live in their physical body, feel like superheroes, which is why we try to protect them from hurting themselves. And as they grow, we start attaching ourselves to cognitive thoughts. And these thoughts can either propel us, motivate us, but also can bring us down a path where we start having negative thoughts come in and hold us back. Overworking habits can form from this. People pleasing at our expense can happen from this. Feeling guilty, shame, blame, holding on to things from, experiences that we're not proud of. Life is about here and now. All is well. Learning to correct and continue and move forward from things. Life is a series of experiences, and we as human beings judge our experiences as positive or negative. That judgment is a thought. Anxiety and depression is a thought disorder. Recognize that self-doubt, that fear, that negative stance that you have is a thought. And so working on your thoughts is important. But first of all, you have to first notice where do they come from. We don't have to do deep psychotherapy to go back into your childhood and understand where your thoughts stemmed from. But it is good to sometimes understand maybe what was the first experience I experienced that brought in fear, that brought in self-doubt. I do something called EMDR, eye movement desensitization reprocessing, where I take people back into their own memories. And they sometimes can pinpoint exactly the memory where they were compared to a sibling, they went through a trauma and felt broken or less than, a person didn't ask them out and they felt ugly or not good enough. It's incredible how we sometimes form negative thoughts from experiences that really are not alluding to that. And then we hold on to that thought like it's reality and it's a fact. And that holds us back from ever trying to be a better version of us. And so working through your thoughts is about paying attention, but also going backwards to change narratives, blueprints. And sometimes a thought worked for you when you were young that when you got older stopped working for you. Meaning my mom used to motivate me, hard work doesn't kill you. And that was her way to motivate me to work hard. And I would work hard. But as an adult, when my mom would say hard work doesn't kill you, I'm like, stop. Mom, your hard work and the job you had couldn't kill you. My hard work can kill me. So once upon a time, it motivated me. But as I got older, I had to reconceptualize it to say working efficiently, working smart is better than just working hard.
So let's talk about the process a little bit. For people that tend to be stuck in these repetitive negative thoughts, how can they make that shift to live in a more positive aspect?
Many times, I think it is about us pausing and reflecting. We stay very busy in today's world. We have a lot of technology addictions. We're oftentimes, instead of being a human being, we have become human doers. And, my book, A Deeper Wellness, is really about bringing in reflection on the patterns of recognizing your physical symptoms, your negative thoughts, your anger, your irritability, your anxiety. And anxiety is oftentimes about fear and self-doubt. I often tell patients, make your faith bigger than your fear. Fear is self-doubt, and that's tied to anxiety, and anxiety related to, do I have the skill set to get me through things? And faith is believing in your skill set. Notice believing and self-doubt are both thoughts. Which thought do you choose? Life is always going to be about choosing one thought over the other. When we feel it's too hard to choose a positive thought over a negative, you got to question why. What is the stickiness? What is the pattern of habit that I have formed that I have to break? And learning to explore starts with just taking an inventory of your own life. What is working for me and what isn't? Try to take an inventory of your negative thought patterns and then identify and challenge those negative thoughts in your life. Learning to rewrite and reframe negative thoughts is a big way to start helping you. And sometimes even turning a new dialogue. Mantras and affirmations are about just reinforcing a positive thought so that you don't have a negative one. You can't have two thoughts at the same time. So life is about replacing one thought with the other. Instead of me ruminating and worrying about a negative thing happening to me and a worst case scenario, I need to remind myself that I can imagine a best case scenario. When you're in the here and now, You're simply being, doing, and experiencing with all your senses. And so when you're in the present moment, in the here and now, or when you're meditating, you're simply doing one thing with complete presence. In those moments, you're not thinking, you're just doing. So think about times where you're hanging out with your friends and you lose the concept of time and space. You're like, oh my God, 4 hours went by. How did that happen? When you're in that bubble, you are simply experiencing, doing, and you're using all your senses. You're not thinking. The moment you leave that moment, in that present moment, your head gets involved. And when your head gets involved, your mind goes to two places. It can go to the past and think about regrets, memories that things didn't work out well, and start comparing yourself to now to a memory from the past. Or your thoughts go to the future. And the future is imagination. You can imagine it to be as beautiful as you like, but most of us do the opposite. We imagine worst case scenarios and we forecast worst case scenarios. We catastrophize. We worry. What is worrying? What if this happens? What if that happens? Remember, imagination means everything in the future is possible to happen. It's a 50-50 chance. But many of us have a tendency to overestimate the likelihood of bad things happening than accurately looking at life. So your past and your future are where your thoughts live. And so bringing yourself back to the moment to breathe and focus and get out of your head is the key. And one way to do that is focus on your breath, because the breath is the only thing that goes moment to moment. And the other way to do it is to replace the negative thought that is plaguing you, that is tying you to the past, and looking at something negative that you're stuck on and racing about it in your head and going through an anxious spiral, or going to the future and forecasting worst case scenarios. So to be in the here and now, focusing on your breath is not one way. And the second way is to replace the negative thought with a positive one. So if you're feeling afraid, instead replacing it with I am capable, I am capable, I am capable. During the pandemic, I gave a lot of people the affirmation to just say in their head is, I am safe, healthy, and protected. I'm safe, healthy, and protected. I'm safe, healthy, and protected. You're feeling a stranger in a crowd. I'm loved, adored, and respected everywhere I go. I'm loved, adored, and respected everywhere I go. Learning to replace the negative thought with positive thoughts. It might not feel comfortable. It might not feel like you believe it, but life is about reinforcement. What are you focusing on? What you focus on expands. You focus on the negative, that will expand in your vibration. You focus on the positive, that will expand too. But slowing down to catch your negative thoughts is the key. And then doing something about it to find a new way to live with those thoughts by replacing it, by coming in with strategies, by breathing and slowing down your day versus racing in your head and just doing automatic pilot all the time, and getting to a place to identify, challenge not only thoughts, but the behaviors that follow.
Well, you're such an inspiration, Dr. Vermani. I'm just so impressed with your book. I thought it was such a great read. Where can our listeners connect with you, learn more about your work, and be part of your community?
So you can always go to my website, drmonicavermani.com, and everything's on there. I have tons of articles. I write for Psychology Today weekly. I'm on Global News once a month. It is amazing to see all the wonderful articles out there to support people to have better knowledge. Because when you understand things, you're more likely to get the help you need. And then my book is on Amazon, as well as you can get it from my website. There's also an audiobook version of it for the people who feel like they can't read as easily or have ADD and would like to just listen to a book. That works really well too. And then I have online, platform resources like a self-help group called 18 Life Lessons, Start Living, Stop Existing, Start Living, as well as a masterclass coming out on Think About It. Thoughts are powerful things, good or bad. Thoughts shape your life. It's a piggyback off of my TED Talk. And if you want to watch my TED Talk, that's out there too. You can just Google that on YouTube, and it's called Think About It. There's a lot of resources out there. And the one thing I've loved about the pandemic is after the pandemic, many people started looking into resources and bringing out podcasts. And I also start a podcast next month called A Deeper Podcast, helping people just understand things better. The more you understand it, the more likely you feel less helpless, less anxious and self-doubt oriented, and get to a place of taking charge of your life. Always remember, sometimes our life is exactly as we make it We need to put more attention to see ourselves as that VIP, that very important person who needs to work on themselves to be a better version of us. Because when you're in pain, and pain means high symptoms, you spill over onto others. But when you're in a place of health, there's also a ripple effect. Which ripple effect would you like? When you're in pain, you spill over onto others with anger, irritability, anxiety, stress, blame, shame, guilt. And when you're in a place of health, if you work on yourself, you're role modeling others, including your children, your family members, and your colleagues, that they can also work on themselves and be better. When we want a better world out there, it really does start with you. Tune in, work on yourself, do a deeper wellness, a deeper healing, and learn to realize that I am that VIP, very important person I need to put first. When you put yourself first, you then are able to give people the energy that you really want to give others. One of my favorite quotes are, don't give from an empty well, give from your overflow. And so learning to bring overflow is working on yourself. Focus on the basics, sleep, food, exercise, and breathing, and also sustaining a calm state of mind. Calm state of mind is also keeping a positive mindset. Take charge of the energy in your space. What are you reading? What are you watching? Who are you hanging out with? Who are you tolerating that you maybe need to set boundaries with? Learn to start taking charge of the energy in your space. What lifts you? What makes you happier? And each and every day, you got to live life knowing that we are born with the uncertainty of not knowing when and how you're going to die. So you should be living each day as if it's your last. Are you bringing in joy? Are you bringing in gratitude? Are you seeing what's working and how far you've come versus just being self-critical and being hard on yourself?
Well, thank you so much for taking the time to be on the show with us here today.
Thank you very much for having me.
Well, thank you, Dr. Vermani. It's been such an honor to spend this time with you and to talk about your book, A Deeper Wellness. Make sure to visit Dr. Vermani's website at drmonicavermani.com. Well, we're at the end of our time today. I'd like to thank everyone for tuning in. You've been listening to Moments with Mary Ann, where we make every moment count.
In a single moment, your life can change. Moments with Mary Ann is a transformative hour that covers an endless array of topics with the best of the best. Her guests are leaders in their fields, ranging from inspirational authors, top industry leaders, and business and spiritual entrepreneurs. Each guest is gifted and a true visionary, a recognized leader in her own work, and while teaching others to develop, refocus, and grow, Mary Ann will bring the best guest and sometimes a special surprise. Don't miss this. You never know just which moment will change your life forever. Make sure to tune in and visit momentswithmaryann.com for more information.